Good afternoon, everyone, and welcome to the Bridging Gaps Community Crash Course. Today, we'll be discussing how to approach different communities on mental health. I think we've allowed enough time for other participants to join, and we can just start the session as more people join. I am here together with three of our speakers, and I'll start by introducing them as we start the session. Our first speaker is Ms. Simran Maru. She is a practicing accredited counseling psychologist, and she is a speaker on mental health and is a mental health representative at SIO National Group. SIO or SHO, sorry. SIKI National Group and Growth Catalyst. She is the founder of Phoenix Counseling. Miss Maru, if you'd like to say a few words before I introduce the next speaker, welcome.
Hi, thank you so much, Fadila. It's really nice to meet you. I'm really happy to be on this platform. She did a good job introducing me, but my name is Simran Maru. I'm from Eldoret. I'm still studying psychology, and yeah, mental health is basically my passion. It's my profession. So I'm really happy to be here, and I really hope I get to work with this amazing group soon again. So I'm excited to begin. Thank you so much.
Thank you, Miss Mario. Your energy is very positive, and I know that the session is going to be very interesting with you around. We have our next. Our next speaker is Mr. Julius Barraza. He is a medical psychologist, and he graduated from Moore University in 2016. Currently, he coordinates an empath mental health care program called SIMS, which is scaling up and improving mental health services in Western Kenya. His work entails public education, screening for common mental health disorders, linkage, and follow-up. He also works with facilities to grow their capacity for providing mental health care. Currently, he's based in Uasin Gishu, Bungoma, Busia, and Trans Nzoia. Mr. Barraza, if you're around, please say hi, introduce yourself in case I've missed anything, and we can continue on.
Thank you, Fadil. I think that was quite exhaustive. As mentioned, my name is Julius Barasa, and I work a lot on community mental health initiatives, and I'm glad to be here to just share how that work has been and how we can all be part of it. Thank you, Fadila.
Okay, thank you so much, Mr. Barraza, and welcome as part of our speakers. Our final speaker is, I really don't want to massacre the name, so Chine Ujagbor. Before I continue, please tell me how to pronounce your name.
My name is Chine Ujabor. I'm from Nigeria.
Okay, now I can continue introducing you properly. So Chine Ujabor is an avid mental health advocate and researcher. She studies at the University of Abuja in Nigeria. She works with organizations such as Let's Talk Mental Health as a consultant, and she's the team lead of that organization. As a consultation team lead, she's also a member of FAMSA and SCOPA for population activities. Welcome, Chine. I'm sure everyone will remember your name and whatever you're going to say today.
All right, thank you.
Okay, so just to begin, we'll just discuss the first question, and I think I'll just pose it first to Ms. Maru. The question is, what is mental health in your own words?
Hi, sorry. I just realized I was on mute, so I was talking to myself for like a good 2 minutes. Okay. Hi, can you hear me?
Yes, now we can hear you.
Okay, sorry. Yeah, okay, I just wanted to say, yeah, that introduction was really good. I really liked getting to know all of the people that are speaking with us. You guys have really, really interesting profiles. And I would definitely like to work with all of you in the future sometime. So yeah, let's discuss mental health now. So Mental health for me is basically anything that includes our emotional, psychological, and social well-being. It's basically the overall term which helps a person or an individual, kind of determine how we do things in life, how we feel, how we act, how we think. I think everything gets affected by our mental health. So it's very important at every single stage of our life. And I think that mental health is something that should be addressed from, childhood to adulthood. And yeah, there's no restrictions in mental health. I think that it determines really how well we can handle certain situations. How do we handle stress? How do we handle things that relate to other people? How do we make choices? And examples of mental health is just the state of which your mind is at. In layman's term, that's what mental health is. It's really, where is your mind at? How is your mental capacity to live this life that we're living? And our mental health is just the well-being and the overall well-being, I personally believe, of our state of life. And I think that it affects everything, physically, socially, mentally, emotionally, everything gets affected. Mental health also affects, and covers a wide array of mental illnesses and mental disorders, which are conditions that are known to affect your mood, your thinking, your behavior. And commonly known, mental disorders are depression, schizophrenia, eating disorders, anxiety disorders, addictive behavior. So I think personally that mental health is something that genuinely affects kind of like every aspect of your life. Like without good well-being in your mental health, I personally believe that your progress in life, where you want to be, can you achieve your purpose, all of that gets hindered. The inability to process stress and to handle the negative things that happen to us is what comes under mental health. And if you can handle it and you have a good state of mental well-being, you are very able to move past the negatives that are inevitable in our life, because truly we can't avoid anything in life. We can't really pretend like anyone's going to have a perfect life from beginning to end. We're always going to have hurdles, we're going to have issues. So it's really just the way that you're handling these situations, based on the capacity of your mental health, the well-being, the overall well-being of mental health. I think that's it's very mandatory. So yeah, to sum it up, I think mental health just covers the emotional, physical, psychological state of your mind, and its effects on your body and your entire life. So yeah.
That was a really good exhaustive definition. Thank you so much, Miss Maru. We'll just using her definition on mental health, the aspect of it encompassing everything in our lives and all aspects of our lives, and everything has to be working for you to have a proper mental state. Mr. Baraza, if you can just use that, why is then mental health important in community education?
Thank you, Fadila. And just basing on what we've been told as the definition of mental health, a state of well-being that encompasses both physical, psychological, and social well-being. In communities, it's very important to bring that out because it affects the whole coexistence. Now that we're all social beings, and for now, just referring to the context of the community, we have societal expectations of what we are supposed to achieve or what we are supposed to do as part of that particular society and communities. So it's important to talk about mental health because we notice that so many people are affected in the communities, and this hinders their well-being and their social interactions, their physical capabilities, and their psychological statuses, and these, of course, affects their ability to optimally function well within the societal context. And that's why it's very important for us to talk about mental health, because part of it is now to help these people actually recover or do better in terms of those aspects of well-being, for them to be considered normal in the society and for them to function and integrate optimally with the people that surround them within these communities. So it's very important for us to talk about mental health in the community because it plays a big role in our coexistence and in our daily activities, basically within these particular communities.
Thank you so much, Mr. Baz. I also agree with you. I think that mental health is important to be discussed from the bottom up, and we just can't deal with mental health issues when they're in hospitals. People need to be educated about it from the get-go. And I'm just going to go to our next speaker, Miss Chine. You're from Nigeria, and this is a question that I'm going to ask all the speakers, but I just wanted to start with you because I'd like you to tell us what is your experience in working with the Nigerian community on the subject of mental health, especially because the African community in general has considered mental health to be a taboo.
Okay, discussing mental health with people in Nigeria. Oh well, it's sort of difficult because most times, especially people that are like above my age grade, above the people that I work with, people that are above, they think that mental health is not something that people should take seriously. I remember I had a conversation one time with one of my family members, and then she was talking to me about depression. She said that people that have depression are are actually have depression because they want to have depression, or they're like stupid people. It's like they made the choice to have mental illnesses. And hearing this kind of thing just makes it seem like mental health isn't something that should be taken seriously, you know. But over time, with more people I get to work with through our consultation platforms, people deal with mental health illnesses that they've suppressed for so long. They don't even know what exactly they're dealing with. They don't know if it's anxiety or depression or schizophrenia, because we don't really talk about these things because we don't really think that they are things that we should be taking seriously in the mental health are created, and people get to open their minds to the reality of these things. So in summary, it has been it's been worth it actually.
Thank you, Miss Chine. I don't know if it was just me, but your audio was breaking just towards the end. But I think I just got a bit of what you were saying, that it's the whole aspect of mental health and it being an illness in our minds, and us not being able to see, when someone breaks their leg and you can see them breaking their leg, they're sick, but then with mental health you really can't see it. So I think handling it in community level, and just from what you said, that people might think that you're just making it up, and it's all you, it's not really, you're not really sick. I think that's really interesting to think about. I'm just going to ask Miss Maru, the same question. What has your experience been in working with your community on the subject of mental health, especially since the taboo, and now added to the fact that some people may not believe that mental health illnesses really exist?
Yeah, that's a really good question actually. I can say this for a lot of the African community generally, I mean Kenya, as well as the brown community, so the Asians, the Muslims, brown community in Kenya, Africa in general, I think, I suppose. There's a lot of stigma around mental health, and it's something that's so inevitable. Like you may think you're bringing in awareness, and we are, and it's making a huge impact. But I think that the impact has now begun to rise much more because people are now finally kind of seeing that, okay, really there's nothing I'm doing to fix my situation. So how it is mental illness is something that can't be seen. So I understand that, and other people will find it very difficult to understand and believe that you're going outside, so how can you be depressed? I've heard a lot of this, oh, but she's, she talks so much with her friends, she's so talkative, how can she have social anxiety? Or something like, oh, she's going to meet her friends and she's always out of the house and she's going to work, how can she be depressed? What people fail to realize is that mental illness is a very personal thing, and how everybody experiences it is very, very unique to their own personality traits and their own state of how it's going to be experienced. Now, even with counselors, I'm a counselor, I'm sure everyone here has, our speakers all have mental health background of some kind. And that doesn't mean there's also the stigma that, if you're studying mental health or you're a counselor, that you have no issues. I do, however, believe that the stigma is mainly caused because of generations that have been passed on, and the generations
have had a very hard time in accepting that there's a mental illness, because it makes people seem weak. It makes people seem like they're making these things up. It becomes an excuse for the older generation. Oh, that's an excuse because you're too lazy to get up. That's an excuse because you don't want to do something. What they fail to understand is that psychology has actually been around for a very long time. It's just that people have a harder time in accepting it. So I hear a lot of these, I get a lot of questions. You'd be surprised. I started working on mental health issues and webinars a few months ago, actually. And I decided to do this during COVID because I had nothing to do. I was literally going out of my mind. And I think that mental health is something where if you really focus on it, you can fix so many aspects of your life. Like, I don't believe that a person needs to have an issue to go and see a counselor. And that's one of the biggest questions I get asked, There's also this stigma, continuous stigma of, oh, you've got to have some serious issues to go see a counselor. But no, you don't. You just go to a counselor when you think you need to talk about something, and it's not to your friends. It's to a mental health professional who knows and understands the roots of why these issues are causing hindrances in your life. So it is a really, I think for brown families also, it's taken as a sign of, I guess it's not accepted. It's like, they won't accept that you're anxious or you have anxiety unless and until the older person kind of experiences something. And then you can tell them that these are, symptoms of dash and dash and dash. And I understand that, because I think back in the day, due to lack of research, lack of awareness, lack of acceptance, a lot of the communities, the brown communities especially, we are not from a first world country. I think that first world countries have had a much more longer term experience and exposure to mental health issues. But for brown people and Asians and the African communities, living in Kenya, as my family's been here for generations, so I speak as a Kenyan. It's taboo. It's something that's not accepted. It's a sign of weakness. And I think that as time goes on and as generations are realizing that, oh, okay, a lot of these issues really can't be fixed because they're mental health issues. We can't tell someone to get up, it's not going to work. We can't tell them have medicine, it's not going to work. That's when now people are realizing that, oh shit, these things are real. Yeah, older people getting into depression because the world is, coming apart, or they can't accept retirement, then they realize it. So that's kind of the experiences I've had. But I also see that there is an impact, and I think that it is growing. So that's really good.
Thank you so much, Ms. Mara. I think I agree with you that as Kenyans, we all believe that mental health doesn't exist until something happens to the person who cries for depression, until they actually see something happen to that person. Maybe he drops out of school or he loses his job. And that's when people start realizing, okay, this person might be actually having a problem. And I think that prevention can actually help before that person gets to that stage. And I'll just finish off with Mr. Baraza, the same question. What has your experience been in working with your community? Since your work is more towards the western side, so the western part of Kenya, Uasin Gishu, Bungoma, Busia, Trans Nzoia, are there any unique issues, something that's not been talked about yet, about the things that you've experienced in that community on the subject of mental health?
Okay, thank you, Fadila. And I think most of what we've experienced have been mentioned by the first speaker. And as we work with these communities, as we engage with them, we notice that most communities know mental health for what it is not. And that's what usually brings about trying to get other explanations as to why people might be having symptoms of mental illness in the community. That's why you'll hear about issues of family curses, issues of witchcraft, issues of demonic possessions, simply because some of these people, especially when we're looking at people with psychotic symptoms, might be having delusions and hallucinations. And usually some of those are related to religion or other family histories that people now might want to start explaining with sort of justify why that person is behaving so. And this, of course, now brings the challenge of actually handling this particular causal attributions to why people have mental illnesses. And in my experience also, people who, as we from maybe on this forum might know that we have a range of so many mental disorders, and ranging from the mild conditions to the more severe conditions, people in the community might only know a person with severe mental illness as someone who's having a mental illness, and they leave out all these other people with mild symptoms. And as you say, this community approaches actually entail at trying to get these cases at early stages and trying to prevent escalation of symptoms. So people might not know that somebody with some mild symptoms might actually be developing or might be actually suffering from a mental illness. And that's one of the things that we've experienced. And we noticed that a lot of community education and working with communities and having actually people from these communities leading some of these interventions have a very big impact in terms of how the community takes it. We'll give an example of how it can actually be very difficult to handle the issue of actually stigma and the societal explanations that are not based on science. Recently, we were doing a home visit to a client that we were following up who had been enrolled into care and was just like around 2 months into care. He had a diagnosis of schizophrenia, and we were managing him on antipsychotics. Of course, the family was very poor, and this is one of the things that complicates, especially people with mental illness, in terms of their capacity to access care and just also the way they perceive the condition. So this person was on medication for several weeks, and he had actually greatly improved. But now, as we say, people are looking for other explanatory models, and that's why they're also looking for other sources of help apart from the medical help that we all know of. They're looking for the church to pray for this person. They're looking for the traditional healer to come and do that thing for this person. So we visited this home and we asked, now that you've seen this person is quite improved compared to the way he was a few weeks ago, what do you think has attributed to this improvement? So we thought that with our engagement with them and with our education about mental illness, they will know that the medications are the things that have supported this person. What he needs now more is social support from the family. They actually say that prayers were the things that actually had helped this person improve, because after we had initiated medication for several weeks, they had called in somebody to pray for the person. So they believed that the prayers had really worked, and they were actually planning for more prayer sessions for this particular person. So that just lets us know that there's a lot of work we need to do. And apart from the community approach, the societal approach, where we're getting many people in one forum and educating them, it also makes sense, or it's very helpful for us to also individualize some of these education sessions. Let's say you've identified families with mental illness, and especially those that have a very strong genetic attribution. It's very important to have talks with these particular families and just talk about why people from that family are having mental illness, because that's where you will see people explaining that maybe it's a family curse, maybe the father did something wrong, the grandfather did something wrong, and why they're seeing several 2 or 3 cases of mental illness in the family. So very important to also individualize some of these interventions, even as we engage the public in these education sessions for them to know what mental health is and to debunk some of the myths that these societies hold on strongly about mental illness. And just to continue saying about our experience, that all is of course not in vain. We've had success stories, and this is what keeps us going, because you will get patients who don't do well, but then you will get other patients who do well. And this has come up strongly, especially with people with substance and alcohol use disorders. When we see someone transform and slowly cut down on their substance use, and they become responsible through our behavioral activation interventions, and then resume their sense of responsibility in their families, that really helps us to keep on visiting these communities and to engage more people. And that gets us gratitude, changing one life after the other, linking these people to sources of care, and also supporting them to actually improve and become productive people in the society. Thank you.
Thank you. Thank you so much, Mr. Baz. And I think very important what you said, that as much as we're going to the community and we're teaching everyone about mental health, the general public, I think it is necessary for you to treat every person as an individual and understand that because they're individuals, their mental health knowledge might need to be individualized, and more things might need to be said to one person that might need to be said less to another. And I think that's really important as well, in order to provide mental health information effectively. I'll go back to you, Miss Chine, and I'll just ask you, what are some of the challenges that you have gone through in the community as you deliver mental health education?
All right, thank you for that question. I hope you can hear me now, though.
Yes,
Am I
yes, we can hear you now.
okay? The challenges I have faced, I think I pointed it in my last point. I pointed it in my last point. But what I'm really trying to say is people don't really believe that mental health should be taken seriously, especially when you bring to the light of some things that they face that are actually mental health problems, like schizophrenia, for example. Now, people that have schizophrenia here in Nigeria, they would say that the person is probably turning mad. So there is a whole lot of would I say enlightenment that has to be made, because there's even this stigma against certain people that have certain mental disorders, or they will link it to one spiritual thing like that. So that's just a challenge that we face actually. And the fact that people have refused to believe that this could just be a mental health problem and it is not spiritual. Let's just focus on the medical aspect of things. But they be like, no, no, no. I don't know if it's an African thing. Seems like it's an African thing when they always want to just hold on to the spirituality of mental health problems, and it's tiring, honestly. Even down to illnesses like depression, they would say the best thing you should do is to pray about it. Like prayer just immediately clears everything. There was one tweet I saw on Twitter. The person showed pictures of his scars from self-harm, and then comments under it, some of the comments under it were like, he's possessed of the devil. Why would you start harming yourself? And then I decided that, okay, since I'm someone that knows about self harm and everything, let me just educate this said person. And then the person kept on saying, no, that we just want to follow the path of the devil. How can you come and start inflicting pain on yourself? And I tried to make the person know that self harming is just a coping mechanism. People don't self harm because they want to, but it's just because it's it's a way to just deal with whatever pain they are feeling. And then the person just didn't want to understand, you know. So these are the challenges that we face when it comes to mental health illnesses that are not so common and seem very unbelievable to decipher from people. It's not easy, I'm not going to lie, especially in Nigeria.
I get your struggles, Ms. Chinai. You know, I also speak to people about mental health issues even here in Kenya, and I think one of the most difficult things is to try and separate mental health issues from spirituality, because most people believe either you're not praying enough, or you're not praying the right way, or someone has cursed you, or you should ask for forgiveness. This must be a punishment you're going through from God. So I really get what you're saying, and I'm just going to ask the same question to Miss Maru. What are some of the challenges, apart from what you've said, during your experience, that hinders you from delivering mental health education to the community?
Um, yeah, just to quickly add on a few things to what everyone has already said. I think that yeah, Sinead mentioned that there's a lot of difficulty when you're talking to someone about self-harm, and I think that that is actually one of the biggest challenges I've also had. The idea of self-harm, apart from it being a coping mechanism, I think what people don't seem to understand is that self-harm can come in many, many forms. But people who are spiritual will refuse to believe that self-harm can come in many forms. People want to believe, because it makes them feel better, that self-harming is spiritual and there's possession involved and whatnot. And I think one of the biggest challenges in Kenya, I think, and overall, that I probably faced is people just always have this thing of I'm not ready. And I understand it, because the mental health is a very scary aspect. Nobody wants to admit that there's something wrong with them, so they don't want to go to a therapist. But I think that thinking is what I think hinders people from becoming their best versions of themselves. I recently started doing a life coaching certification. And if there's one thing I've learned is that people, a lot of the times what stops you from finding your life's purpose and being your happiest self is this idea of not accepting what's really wrong with you. Obviously we all have issues, and I'm not trying to say that everybody has mental health issues, but there is something in your life that is stopping you from going on to the next level, be it fear, be it your past experiences, be it trauma of any kind, mental disorder, mental illness, mental issue, small, severe or not, there's always something that's stopping you. And there's this belief, as I mentioned earlier, that people will say that you have to go through a lot to go and experience mental health care, just the care of it. And before they go and see a professional, they're like, no, I want to reach rock bottom before I go and seek for help. But my thing is, what I believe truly is, go and seek for help before you reach rock bottom, right? Because it's easier to pull out someone who's drowning when you can still see their hand above water, but it's much harder to save someone when they're already at the bottom of the ocean. And that's an analogy I like to give a lot of people, because I think there's power in that. There's power in understanding that as soon as you feel like something is wrong, go and seek help. It's the same thing with, for example, you have a few issues and you see that these issues, health issues, let's say you've had a cold and it's just a small cold, but you've had this cold for 3 weeks, 4 weeks, 2 months. Eventually you'll realize this small issue is something to go and see a doctor for, and you can solve it from becoming a bigger issue. It's the same thing with mental health. So the biggest challenge I've had in the community, and I think, Fadila, like, you'd understand, you're brown, you're in Kenya. I know there's this whole thing of telling people you need to seek help, and it backfires. It really backfires, and it's really terrible. Mr. Baraza also mentioned that you go to someone and they'll say, oh, prayers help me, not the medication, not the education, not the schizophrenia. Is not something that can be fixed through prayers. Yes, I believe in prayers. I'm sure all of us here have a certain belief in a higher power. And yes, given that belief, of course, you're asking God to help you, it's okay. But that challenge, I think, exists worldwide. I think that whether you're a white person, whether you're a brown person, whether you're an African, whether you're Asian of any kind, there is that traditional mindset in our heads that, okay, if we pray, maybe we'll feel happier. However, the biggest issue, I think, ultimately, to sum up what all of us have said, is this separation that we need to be able to create in people's minds, creating a separation of, hey, listen, this is a mental health issue. It's related directly to your mind, not to anything else. And once that separation gets created, I think that there will be a larger impact on mental health issues, because people will understand that this is something out of our control, and also not in the control of spiritual forces, which obviously I'm no position to say it doesn't exist, but I'm in a position as a mental health care expert to say that you need to learn how to separate the two. So those are some of the things. Another thing I actually, Mr. Baraza and Chine both reminded me of is I had this experience where, if you're brown, so trust me, Chine, this is not just an African thing. Brown people have a very big ego issue. So they will not accept when their kids have serious illnesses like autism or schizophrenia. You will be easily labeled as crazy. My kid is having slow development is one of the things I've heard, and it pisses me off. Like, excuse my language, but it's like, oh my God, stay woke. Your kid isn't having delayed anything. Your kid is having a mental issue. I could pick up on it. So I know a family, and their son was diagnosed with autism. I knew that their son had autism even before they went to the doctors, because I could see the signs. They didn't want to accept it. And it was so frustrating. I had to literally leech myself away from that family, because there was not, and funny enough, they are in the medical field. Right. So to me, it's like, are you going to be seriously that oblivious and that, like, you need to have this awareness of what's going on, because you should want to help your child. And if helping your child means accepting that they have a mental illness, then do it. So that's one of the things I've faced a lot. I've seen this happening a lot with a lot of people, it's this denial, even when you know that they have autism or they have something of the sort, there's this denial that comes, and they're like, no, it's not this issue. So that's one of the biggest challenges I've had. And unfortunately, I feel like that's still a long way to fix. So yeah, that's definitely something that's, been a very prevalent issue, I think, in Kenya and amongst the Asian community.
I completely agree with you, Ms. Mar. I think that despite all our cultural maybe differences, everyone here just suffers from the same problem of just not acknowledging that, especially our children have mental health issues, and they just I agree with everything that you that you said. Actually, some of the points that you said hit the nail on the head so hard that I chuckled a little. I'm glad that I had muted myself.
It's very true, though. It's just something that we have to accept is the case. It just is what it is. We have to now work towards changing that mindset, I guess.
It's very, very true. I think I don't know, Mr. Baraza, if you have any other challenges that you have gone through, because during your experience you also discussed a little bit about that.
Yeah, sure. I just in addition to, of course, the societal issues, the stigma, and what my other presenters have mentioned, it also comes to the issues of human resource to support this delivery of mental health services. With our experience in the community, we've noted that the primary level facilities are grossly understaffed. You might find that a health center or a dispensary has only 2 staff, and they're overwhelmed by all these other conditions they're managing, and they're unlikely to also be able to support delivery of mental health services in those facilities. And then just in addition to that, you might notice that not so many people, including the primary level care providers, have adequate training in mental health. And usually you will find that most of these people with severe symptoms of mental illness are referred to higher levels of care as compared to being initiated on care at the primary level. And over time, we've noted that most of these conditions can actually be managed at the primary care level, and they don't have to be referred to the referral facilities or to the county facilities where we have now the more complex cases being managed. And that's one of the challenges, the issue of inadequate staff to support mental health care. And then, of course, just the capacity to be able to see these patients if they're also there. The other challenge that we faced is now that we're talking about community education and sensitization, of course, apart from mental health issues, there are also other economic and financial issues facing communities. And when you're not careful, you're likely to run into communities expecting much more than what you're coming to offer. Let's say you're coming to offer the education about mental health. They might think you also want to offer other social support. Let's say you want to offer financial support, for example. And studies have shown that poverty is also related to the complications of mental illness. And when people are not able to and don't have access to these services because of their financial incapability, and then they're likely to jump at any next opportunity of somebody coming to educate, and they'll feel like you'll now have all the solutions to their mental health problems, including maybe paying for their bills and just having them access care. So very important to manage expectations in terms of if you're coming to offer care, just be sure as you start to offer education, be sure to manage any other expectations apart from the service that you're coming to offer in the community, and that will help the intervention actually grow in that particular community. And then just to touch on the issue of manpower also, it's one thing to sensitize the community, but it's another thing to also show them an affordable source of help that they can have access to. So maybe I'm moving a bit into some of the mitigation. As you sensitize, you should have a source of care available for them to actually have access to, because if you sensitize and then they didn't have access to any kind of care, then most likely they will not travel long distances, things that might have hindered them previously from accessing care, to go to seek the care that we've advised them to seek for. So mainly that, I think the other challenges have been mentioned. And then just also to touch, and this comes a lot to my issues of human resource. When we talk about care for mental illness, we talk about holistic care, both the biological, psychological, and social aspects of it. But then in these communities, you might find that you're not able to find all these components. And it's one thing giving a patient with schizophrenia antipsychotics. It's another thing having the family accept them and be supportive in terms of their follow-up on care. So another challenge is it's very hard sometimes to implement this holistic approach in communities because of the limited human resources.
Thank you so much, Mr. Baraza, for elucidating some of the extra challenges. And I just remembered as you were talking on your last point, I had visited Eldoret, the mental health unit in Moi University Teaching and Referral Hospital. And something that struck me very interestingly as I was having a conversation with the psychiatrist is the nurse just came in and said, so and so has been readmitted again. And the psychiatrist asked, why is he been readmitted? And she said, the family does not want to take care of him. And she asks, did he hurt himself? And the nurse says no. Did he hurt any member of the family? And the nurse still says no. And the lady turns to me and tells me this is a common issue that happens in mental health units in hospitals, is that you discharge a patient, and because they're not able, the family doesn't want to help them, or they're not in a capacity to help them, especially schizophrenic patients, they decide to readmit them again and give you a story about how they can't do it or something like that. And I think this really impacts the holistic care that we're talking about, because then if we have an influx of patients and not enough workers, then no one will be able to get quality standard of care. So thank you for bringing that out as well. We've just reached a 5-minute interlude before we ask our final question to the rest of the speakers. I invite the audience to, if they have any questions, to ask them. But I think just to make it a bit interesting, I'd like anyone to just unmute themselves, just say their name and just how the session is so far. I can start. My name is Fadila. I didn't introduce myself in the beginning. I think I forgot. I'm a fourth-year medical student at the University of Nairobi. I'm a national coordinator at Tubonge. Tubonge is a mental health organization founded in 2019 that basically aims to help you help yourself. So it gives you psychological strategies to solve common mental health issues, common stresses that happen in life, like failure, fear, and things like that. And I'm also the outgoing chairperson at the University of Nairobi Mental Health Club. So anyone else would like to introduce themselves, please do.
There are questions on the chat box sent by somebody, so maybe you could read them out, and whichever one of us can answer, we could answer. First of all, I just wanted to say also you're doing a really good job. Yeah, you did forget to introduce yourself, but it's really nice. I do know Tubonge, and I really like that entire group and what it stands for. So it's really nice meeting you, and thank you for having us and hosting us so well. I just wanted to say that.
Oh, thank you so much. I didn't even see the question. Okay, so we have a question from
there are 3 actually.
Oh, 3. Okay, now I can see them. Mr. Ogbu, the first question is, as mental health advocates and organizations, how do we effectively grade the level of education and awareness individuals in the community have regarding mental health? So I think I'll just throw this to you, Ms. Maru.
Yeah, that's fine. So how do we effectively grade the level of education and awareness individuals in the community have regarding? Okay, so I think he's just basically asking, how do we understand and grade and kind of see where their education levels and awareness is in individuals in this community about mental health, right? So there was a way, I mean, okay, first of all, you need to understand that as mental health advocates and these organizations, we need to kind of see how many students, how many people do we have in the mental health sector in the first place. This applies to all over the world. There was actually a study done a few months ago. I was reading a study on just, worldwide mental health populations and stuff. And to be honest, yes, there are people who are studying psychology. The number is getting quite high as the years are going by. So there's that good news, is that people are actually willing to study. So what I'm picking up on is the way to grade the level of education and awareness is that the youth is more aware. And their level of education is actually increasing slowly. It's not a very high-paced increment, but people are now actually recruiting and looking for psychologists and mental health care people. I actually tell a lot of people, get into this as a career path if this is something you're passionate about, because I can promise you guys, if you guys remember me 5 or 10 years from now, it's going to be a very big thing. 5 or 10 years from now, there's projections also that psychologists are going to be more looked for. Even right now, first world countries are actually recruiting psychologists and people who are in mental health. They're giving out scholarships. They're looking for, because there is a lack. There is a lack of the older generations above our age that have actually dedicated their lives to this thing. So the youth, and there are elder people, in their 30s, I guess you can say. I'm not sure if that falls under the elder category, but there are, people who are 30 and above who have been doing this for a long time, and they're the ones encouraging the youth to get into that. So the way to grade it is to kind of see systematically, depending on the community or the country that you're in, the best way to do it is to see, okay, one, what are the healthcare facilities available? So if you come to a place like Eldoret, we have one of the best mental health care facilities, which is MTRH, Moi Teaching and Referral. However, our private hospitals barely have anything to do with psychology, have any, finding an internship for myself over here was so hard that I eventually applied to become a counselor so that I don't have to go somewhere to do my attachment, and I can do my internship as a practice. So the thing is that that's a one way to measure it. When you go to Nairobi, a larger city in Kenya, yes, there are lots of mental health care services. Why are they not available in smaller cities? Do people not have mental health care issues there? Of course we do, but they're not available because there's lack of awareness, there's lack of education. My entire batch right now is a very small batch that's studying in Eldoret about psychology. And that's kind of one of the ways that you can judge their level of education and their awareness in individuals. When you go to a place like MTRH, sadly to say, they have an amazing unit, but to get into studying there, there are certain requirements that not everybody can meet. So to me, those are the things that hinder your people's progress, right? That's one way to measure it. So systematically, you're seeing, okay, in this city, are there mental health care facilities? If not, then you already know that there clearly isn't a level of importance given to this city as individuals on mental health. There's a huge lack of that. When you go abroad, why is there mental health care facilities? Why do people pay so heavily for counselors? Because they understand the awareness. Those individuals understand the importance of it. In fact, in I think it was the US a year ago or 2 years ago, they made it mandatory to have, in certain states in the United States of America, they made it mandatory to have psychology or mental health teaching beginning in high school, which is something that we are so far from. We are incredibly far from that. But they understand the importance, and that's how you really measure the level of education and awareness in people. Because you need to see, when you talk to a regular person, do they even, when you're speaking mental health to them, do they even give it importance? How many people are willing to show up to conversations like this? And what are you doing to impact that? So that's how you measure the level of education and awareness. I really hope that answers your question. Ogbu, just let me know if it does, and if you have any questions on what I've said.
Thank you so much, Ms. Mara. I think what you've said is true. That it's funny how in Eldoret, a small town, yes, but a town that's filled with a lot of private hospitals, doesn't have mental health facilities at all. I'd never noticed that. I think I just noticed as you said it, and it's very interesting. And I think that's also a measure of how well the whole community takes mental health issues. I think organizing activities personally in Eldoret, because we have tried organizing mental health activities as Tubong in Eldoret. We find that we can only organize it sufficiently to university students, that if we let it out to the public, there'll be fewer people involved, which is also very interesting. So that's something to think about. The second question, I'd pose it to Mr. Julius. I hope you're still here. How would we effectively educate and advise people to invest in both personal and community mental health?
Yeah, thanks, Fadila. And maybe as that question is asked, one of the things that comes into my mind, of course, relates to the first question, the level of comprehension of these communities. So one of the things that we usually recommend doing is, as you educate communities, I use a simple language that people from the community can understand. Avoid all the technical terms in your presentations or your education sessions, and just use a language that they can relate to, and mention examples of things that they actually know and can relate to. And that will help you get the message home well and have them comprehend it better for them to implement. And that's if you have a chance to get these gatherings, because I know it's very hard to educate everyone in the community, because these are very vast areas and a lot of people, and it's unlikely that you'll get everyone. But if you can take advantage of some of the community activities that actually happen, let's talk of the chiefs barazas, the other occasions within communities, and then you take that chance to educate people about mental health, and you package the message in a language that they can relate to and they can understand. That is one way you can actually have them be able to invest both in their personal and community mental health. The other approach is if you're not able to get this particular gathering, so if you notice that you're not able to reach everyone in this community, you can work with the local leadership and take advantage of the forums and educate them about mental health. This because these people interact a lot with the communities, and if they are well enlightened, if they're educated well and have an understanding of what mental illness is and why it's important for us to take care of it, they're able to reach this, get information to the communities. They're able to identify people they think might be having symptoms of the conditions I talked about, and they link them appropriately to care. And this could include working with the community health volunteers and community health workers, the local village elders, the chiefs, and then most relevantly, the church leaders, because we notice that many people with, let's say, symptoms of depression or other life hassles that are leading them to mental health are likely to go to the pastor, to the local church leader, for them to get prayers. But if this church leader is sensitized and they know that some things can be prayed for, but some are mental illnesses that need to be managed by a medical practitioner, then they'll be very pivotal people in terms of helping you identify these cases, and actually also just helping you pass the same message in a way that the community can understand within the church forums. So that's another approach you can use to get this message for people to invest in both their personal and community mental health. And the other aspect, as I mentioned, about maybe lack of knowledge about mental health, especially in the primary care facilities, also targeting these primary care providers within those facilities because they interact with patients. And we note that there are so many people with mental illnesses who've been not diagnosed and not treated, and they visit these facilities with these symptoms. And some of these symptoms present as physical symptoms that the primary care provider cannot differentiate from other conditions. So if they know and if they are sensitized about mental illness, they will listen to a patient coming with symptoms and they will raise another question. They say, wait, let's have an assessment of mental health for this particular person. And it will turn out like that the physical symptoms that the person is presenting with are actually symptoms of a mental illness. And that will be the point where this person will get linked to care. So very important to take advantage of the community forums, work well with the community focal people, the church leaders, the local leaders, the village elders, the community health volunteers, and also work with these primary facilities for them to be able to identify at early stages when somebody is not yet very ill for them to need referral.
Sorry, may I just add to that, Fadila?
Yes, you can.
Yeah, so I just wanted to also mention that there's a lot of people who are actually so in Eldoret and obviously in other places in the world, there's a lot of people who are not in school. There's a lot of the local community, the local children, the local out of school teenagers, and a lot of them don't have any exposure, let alone to education, but not even to healthcare facilities or even knowledge. And that's why I think it's really important as mental health care advocates to go and take this learning to them, because obviously they can't find you. There's no way but we need to be very self-aware. We need to realize, okay, we're using Zoom, we're educating people who have access to the internet, we're educating people who have access to education. Who is educating the people who don't have access to these things? Who is helping the minority group who are not aware of mental health or don't even understand what teenage pregnancy is, what sex education is, what is anxiety? And of course, when you're doing that, there's a way in which you do it. You can't just go and start throwing big words at them, obviously, but there's a way in which we need to find a way to interact with the smaller, minor, less fortunate communities who don't have this kind of access to, the internet, to Zoom, to healthcare facilities, because the problem with healthcare facilities is that it seems to me like it's only available for the high class and middle class. Even when people are charging, you live in a third world country, you know that funds are hard. Why are you charging an insane amount? In Kenya, I personally found it really hard to find a counselor that I liked that would even not charge me a bomb, because as much as we have the internet, I have expenses to pay, right? So for me, it's like, even me being a mental health care advocate, being a counselor, thought twice because of the money. So what makes us think that every other average person, who is earning less and who is in a less financial situation, you're not in a very good financial situation, what's stopping them apart from just the awareness and the education? It's also the money factor. And these are things that we really need to focus on, bringing the youth, especially healthcare facilities, at a reachable amount, thinking about their financial situation, thinking about the less fortunate, thinking about the communities that don't have access to internet. What happens to the kids that are going to regular schools, the 844 Kenyan system schools? They may not have access to the internet all the time, and they're not also being taught these things in school. So this is something that we really need to think about. And that's what you need to make sure when you're educating people and advising them to invest in community mental health, that you need to bring it aware. Find a way to reach, the government officials, find a way to make it such a big deal that people actually notice what's going on, and get those people to call you, to assist you, and, use your abilities to do good for the communities that don't have access to mental health facilities. That's kind of my intake. I'm sorry, my intake. my output on this topic. I think it's a very sensitive topic, and it's something that we need to focus on. So yeah, that's my say.
Thank you so much to both Mr. Julius and Miss Maru for that. I can see Chinay has just added on the chat box that she completely agrees. Chinay, is there anything you'd like to say on any of the 3 questions that have been asked? The last question was the one that Miss Maru had answered, that there's a large number of out of school young people. How do we cater for them as well?
Okay. Well, in that case, I guess there will definitely be difficulty because there's some low level of literacy when it comes to them. And like I said, they would probably think that what mental health is about is most likely linked to the spiritual. But then again, I guess it's just about putting yourself in their shoes and looking for practical ways to connect with them, instead of like Ms. Mara said, instead of using big terminologies that that definitely they will not understand, you can decide to use visual aids, to just really connect with them on a very practical level, and subsidize, or should I say make mental health treatment free, since they can't even
accessible and
it.
available.
Really, because since they really can't afford it, it's just best to make it very accessible, like she just said, to them, and let them really understand that mental health is real. I mean, mental health is something that we should really sit down and talk about, because it makes the entirety of everybody. Actually, if your mental health isn't fine, or if you're not sane, then it affects every part of you. Depression leads to back pains. Depression leads to tummy pains. It leads to a lot of things, and so does any other mental illness. So it should be something that we make readily available for these people, and make it as practical as possible, basically.
Thank you, Ms. Chine. I've just seen Ogbo has asked to speak, so I'm just asking him to unmute right now. He's raised his hand.
Yeah, hello. Good afternoon. Good afternoon, Fadila. Good afternoon, Mr. Murray. Good afternoon, Mr. Julius, and good afternoon, Chine. I'm Abu, team lead and co-founder of Let's Talk Health. It's actually an honor to be here with you all. I was just going to comment on the first question, the one I asked about as mental health advocates and organizations. The thing is, for us at Let's Talk Health, we are a youth-led mental health organization, and actually we've been doing a lot of advocacy and awareness campaign on mental health for a while now. And I'm thinking, okay, how do we actually gauge to know, okay, these people are actually educated about this mental health issues? It's, you know, it's one thing to like put out the materials and the content on the social media platforms, or maybe through one-on-one conversations and discussions on mental health. How do you actually know that these people are actually getting this information? How do you, like, is there like a test or maybe survey? Like we run some levels of pre and post survey at Let's Talk Health due to the nature of our mental health discussions. But are there other things we could do? Because it seems as though the surveys are looking too technical for young people to like adapt to or associate themselves to. So are there other things we could do, maybe just to gauge? I don't know if maybe from your different levels of experience, you've had cases where you like maybe run a test or anything to gauge the level of awareness and knowledge people have regarding mental health. Are there other things we could do aside maybe surveys, or just trying to know if they could pay for therapy, or if they could do one or two things relating to mental health? Like specifically, are there things we could do? Yeah, so that's my comment.
All right. I just personally feel like some of the things that we could do, one is implement, like you mentioned, surveys, which I think is a really good way. But another thing to implement when you're trying to truly measure it is to kind of just find a sample in every kind of group. So you can either find a sample in the universities and find samples of industrial or organizations, and then find a sample of a certain youth group, then an elderly group, then a younger group, then in different institutions. Once you find a sample, you can ask them, you know, through interviews or through a survey or through a case study or even observation, to see their level of understanding of mental health. Do they have their employees or the people working for them? Do they understand mental health, the aspects, the needs, the importance of it? Do schools understand that their children could be affected by mental health issues? Do hospitals offer those services? And you can find that out using and carrying out particular ways of research. And a lot of the times you can use university students to do that, because the advantage of being a university student is that we are taught how to conduct research. And if you could get a group of university students to carry out research in certain parts of your country or your town, then you would be able to actually gather that information and measure the awareness and level of understanding more accurately. So that's kind of my my approach on how I would do it.
Thank you, Michelle. Yeah, for the second question, I was just going to make a quick comment and then I'll get further input. Regarding the personal and community mental health investment, you mentioned that there are a lot of people that actually don't have access to this mental health care and they can't really afford it. And it's one thing to actually want to like provide mental health services and mental health care to everybody in the community, but it's another thing to actually have enough resources to do that. So for mental health organizations and mental health advocates, how do we maybe get access to funding opportunities or programs in which we could actually, from institutions and organizations, like you mentioned, the US, they've had programs for their high school kids to actually have good access to mental health services. How do we attract such nature of programs or such nature of funding from this first world country over here to we staying at the third world country, so we're able to make mental health services and mental health care available to all those that can afford it, those that can barely afford it? How do we actually help in subsidizing mental health services for our people?
Mr. Ogo, has your question been answered?
Yeah, I'm asking concerning the second question.
He's asking how we can attract those kind of programs in our communities. I think if I'm not wrong, that's what he's at. Yeah.
Yeah. Okay. Mr. Julius, because we don't have any time, Mr. Ogo, I think that would be the final question. I'm sorry. We're heading towards the final question. So, Mr. Julius, if you can just answer his question of of how we would just have those attractions.
Okay, thanks. I will have a go at it, and maybe we can also get other people to contribute to it. So one of the things that we've been doing is trying to work very closely with the county ministries of health, because we noticed that some of our interventions might not be very sustainable if we don't include the counties. And when we get the counties paying and then buying, and then they're able to be part of this particular process, we notice that they have a larger capacity to actually forge some of these interventions forward and actually support some of the systems that are necessary or are needed to continue this intervention that we are trying to bring to these communities. So one of the things that we do is try to engage as closely as possible the county ministries of health to be able to be part of this particular interventions, and with the goal that eventually, as we try to build capacities, as we try to build structures in these primary level facilities, these ministries can be able to pick those up and continue offering interventions even in our absence, because we notice we might not be here for very long or forever, but then the Ministry of Health is likely to be here for the foreseeable future. So that's one of the things that we do to try and get the government to actually be part of these interventions. Maybe to another aspect of it is trying to get buy-in, especially for the people we're targeting, let's say the youth. So if we try to integrate some of these initiatives in the activities that the youth undertake, let's say it's gaming activities, it's leisure activities, and to try to integrate some of these mental health services within those activities, we notice that you're able to get good buy-in into those activities. And I think I and Fadila were part of one forum where we were just trying to get some of the input from the youths within the slums of Eldoret and what they think will be entail good youth-friendly services for them to be able to access mental health care services. And we noted that they would actually like to have some of these initiatives integrated into the things that the youth do. Let's say it's sporting activities, it's photo shoots, other activities that youth engage in, other public service activities that the youth are engaged in. And this will be very good forums to have the youth buy in and be part of some of these interventions. I just take, I don't know if that answers the question well, but we can also get input from other panelists about that question.
Yes, I think because of time, I'm really sorry that we just have to move on with the next session, because we have some of the speakers who'd like to also go for the other commitments. The final question was how should we approach communities effectively on mental health? And I think we've kind of answered it by going through the questions that we have before. And I think I'd just like each of the speakers to just take about 2 minutes to just answer this question and just say maybe one main thing that we can do in order to be able to approach the communities effectively on mental health. And I think I'll start with Ms. Maru. How should we approach the communities effectively on mental health?
Hi, yeah, so just to quickly say in 2 minutes, how do you approach the community? The best way to approach a community on mental health, one, is to understand your target audience. It's very important. There's a reason why I've been doing webinars, because my target audience, a lot of the majority of them have access to Zoom. They have access to the internet and stuff. So when you're trying to teach community, you have to know your target audience. When we're focusing on the rural communities of Eldoret, of our country, we then take the workshops to them. So we hold things that will help them. We do an activity, we do cookouts, we do football events. The groups that I'm in, even if I'm not participating, they're also hosting all these things, because they understand that their audience will need physical engagement because they don't have access to the internet, etc. So in order to teach your community about mental health, you really need to understand who are you teaching, why are you teaching them, and what are the medias and mediums you can use to teach them. Another very important thing is in your community, it's very much based on, how can you reach them? That's also very important. How can I reach them? What is the best way to get to my community? How do I access the whole of Eldoret City? The best way is to go through all the universities. The best way is to go through getting connections to all the groups and then bringing them together. I think all those things will really help in teaching your community about mental health. Another very important thing is to understand what facilities and fields are available in your particular community. So if you know that there's no trauma unit in your community, or you know that there's a lack of student counselors, that's where you should hit the nail on the head. That's what you need to focus on. Find the lack, find the gap, and fill in that gap. Become a bridge as a mental health care advocate to filling in those gaps of no knowledge and lack of resources, and try and find a way to collaborate with people who have resources and bringing together all of those ideas and those minds to teach your community about mental health. Yeah, that's it for me.
Thank you, Ms. Mara. I think what's really the most important thing, I think, before giving information to anyone is to understand them. And I think that understanding your target audience really does make a difference in terms of delivery of mental health information. Our next speaker, Mr. Julius, how should we approach the community effectively on mental health?
Thank you, Fadila. And unlike first speaker, my target community, most of them don't have access to these social forums like Zoom and other forums. So for most of them, we do like in-person meetings with them and other community, local community approaches that we apply to try to reach them. And so of note that we've had over the time is that we have this issues that prevent people from seeking care. And one of the issues that we've noted in the community is socioeconomic statuses, the lack of finances to be able to access care. So what we do is try to help them work on those things that prevent them from getting care. Let's say we work with other programs that now offer economic empowerment initiatives through education and helping them to initiate projects. For example, for them to be able to pay for the NHIF, so that now with the NHIF, they're able to access this particular care. So trying to help them grow their economic capacity, their financial capacity to be able to access care is one of the things that we do to effectively reach these communities, be able to access care.
Thank you so much, Mr. Julius. Our final speaker and our final question is Ms. Chine. What do you think would be effective in delivering mental health information to your community? Ms. Chine, are you still with us? Okay, I think it seems that there could be a bit of a internet issue because I can't see her. I can't see her on the chat box. I think we can just end the session there, and I'd like all the speakers to please leave their contact information on the chat box in case any participant has any questions. Thank you so much, everyone, for having listened thus far. And I hope you have all learned a bit on how to approach communities on mental health, the challenges, and how to deal with them effectively. From my side, thank you all very much and have a good rest of your day.
Thank you all very much as well. If you have any questions or anything that you need to talk to me about, if you want to work with me or you need a counselor, anything of the kind, I've dropped my number and my email address into the chat box, so you can take it from there. I do have another webinar coming up in literally like a 5 minutes from now. So if you're interested in joining, it's on body image and everything about it. So if you're interested in that, you just text me and I'll send you the link. So thank you guys so much. It was really lovely working with Mr. Julius and Ms. Chine and Ms. Fadila. So yeah, have a lovely day and thank you guys very, very much. It was a pleasure.
Hello everyone. If you haven't left yet, my name is Cheryl. And I've just dropped the link to the next meeting that Ms. Simran will be facilitating in the chat box. If you'd like to join that, kindly just use that link. And thank you for joining us today, and I hope you've learned a lot. We have one more session coming up next week, next Saturday, so stay tuned for the links for that. And thank you for attending. And thank you, Fadila, for moderating this session. You did moderate very beautifully. Ms. Simran and Mr. Julius and Ms. Chair, that was amazing, and thank you for sharing your knowledge and experiences with us. And we are truly grateful because we are leaving this webinar with a lot more information that will help us better not only our lives, but also the ones of the communities around us who we love. So thank you so much for that. Have a lovely weekend, and we'll see you next week. Thank you. Goodbye.
Thank you, Cheryl, and thanks to everyone for attending the session.
Thank you, Mr. Julius, for that.